Ethiopia, once celebrated for its progress in expanding healthcare access, stood as a beacon of hope in East Africa. Modern hospitals, bustling clinics, and dedicated medical professionals served millions across the nation. In Addis Ababa and beyond, families once gathered in waiting rooms, hopeful for treatment and recovery. Children received vaccinations, and mothers found care in maternity wards. But over the past 7 years, this progress has unraveled. Ethiopia's healthcare system has spiraled into a state of profound deterioration. The outbreak of violent conflict in the Tigray, Amhara, and Oromia regions has shattered the lives of millions. Hospitals have become battlegrounds, and clinics have closed their doors. Since Prime Minister Abiy Ahmed assumed power, the country has been engulfed in violence across these regions, areas that collectively represent nearly 80% of the population. In Tigray, entire communities have been cut off from medical supplies. In Amhara, ambulances are scarce, forcing patients to travel for miles on foot. In Oromia, clinics stand deserted, their staff displaced or in hiding. The wars have not only devastated communities but have also crippled the nation's ability to provide basic medical care. Doctors and nurses work under impossible conditions, often risking their lives to help others. Families mourn loved ones lost to preventable diseases. Children suffer from malnutrition and treatable illnesses, their futures uncertain. The collapse of Ethiopia's healthcare system is not just a statistic, it is a daily reality for millions. The urgency is real and the world must not look away. This is the story of a nation at a crossroads, where hope and despair collide and where the future of millions hangs in the balance. Hospitals in war-torn regions have been bombed, looted, or abandoned. Medical professionals face threats, detainment, and economic hardship, with many forced to flee the country in search of safety and dignity. In Amhara, for instance, patients have been carried for miles on foot due to the collapse of ambulance services, and access to life-saving treatments has become a luxury few can afford. The government's prioritization of military spending over public health has led to widespread strikes among doctors and nurses, who now earn less than $100 a month, barely enough to survive amid rampant inflation. The result is a healthcare system on the brink of collapse, marked by rising mortality rates, untreated diseases, and a growing sense of despair among Ethiopia's caregivers. This is not merely a humanitarian crisis, it is a moral one. When a nation abandons its healers, it risks losing its soul. Ethiopia's healthcare catastrophe demands urgent international attention and a fundamental shift in domestic priorities. Without it, the suffering will only deepen and the consequences will echo for generations.